Hello friends, welcome to day 12 of our quarantine series of Shri Clinic. I am Dr. Prachi. Here we discuss all types of health problems, both physical and mental. So let's start with the topic today. And today's topic is another interesting topic which I think maximum of homeopathic doctors are dealing with right now, and that is sinusitis, allergies, allergic rhinitis, especially in children, and its homeopathic treatment. Yes, you'll feel it's a huge topic, but it's not, because it is totally interrelated. The reason behind this is immunity. The only reason behind the whole concept of allergy is immunity. How? I will explain. So first of all, we should be understanding our immunity, correct? So what is immunity? Immunity is resistance power, will power, vitality, rog nirodhak shakti, rog pratirodhak shakti, whatever you call. The main power within us that does not allow any infections to enter our body to a certain limit. Until we have the good resistance power, we have the willpower going on, the infection will not enter our body. It will enter, but it will also go out without our knowledge. But when our immunity is compromised, we get infections and we get ill and we get other viral and bacterial infections, which are very common. Okay. Normal cold can be treated in 7 days without medicine. That is because it is our immune system that takes care of it. Sometimes you would see that in most of the dengue cases, the blood in which the testing is done, it is positive or it is weakly positive, but the patient is not undergoing any symptoms. So that is, the infection is there, but his or her immunity is taking care of the infection and they don't need that much of medicines, of course. When the symptoms prevail so much that we are unable to carry out our daily activities, that is where the medicines should be interfered or are to be taken. One thing. So immunity is very much important. Now, when this immunity is compromised, especially in this, how? I'll tell you. I have an image which will tell you how the immunity patterns are set up, right? Especially for each and every system in our body, be it respiratory system, be it digestive system, be it the rectal system, be it gastroenterology, be it liver system, be it your skin, be it your hair. Each and every system has its immune system. Okay. Now we are talking about respiratory. We are talking about nose, sinusitis. So we'll be seeing respiratory immune system where you get this. Okay. So as you can see, as you can see, this is our respiratory system, correct? So when this is our respiratory system, this is our nose, this is pharynx, this is larynx, this is trachea, this is bronchus, this is right bronchus, this is left bronchus, and the lungs, right? So these 6 to 7 members comprise in our respiratory system. One thing. Now, when an antigen or when a virus or bacteria enters your body on an everyday basis, right now, even when I'm talking, if someone is just sneezing out there, his or her germs are going to enter in my system. Of course, that is a basic rule. It will enter, it will attract our mucous membranes. When it enters, it depends on my immunity of the nose that how much it is going to go down. That's it. So when I talk about nose now, nose has its own immunity which comprises of nasal hair and nasal mucus. That is why it is necessary to have nasal hair and mucus in there. So when the antigen enters, it will just trap itself there and just throw out by sneezing. When the sneezing is done, if at all your immunity is not that good in the nose part, it will go down in the sinus part. This part. In between pharynx and nose, there is a sinus part where you will develop sinusitis if the antigen is more stronger than our immunity. That happens. After that, it will go down to pharynx and larynx and trachea, where your immediate response will be coughing, and after that it will go down. Once it passes this, the lower respiratory tract, it will cause major diseases like asthma and bronchitis. So this, basically, we have immune barriers on each and every level but it depends on our own immune system how much it should be compromised. That is one thing. Now when we talk about the respiratory infections such as sinusitis, allergic rhinitis, nasal polyps, adenitis, so many things are there. When this happens, cold, flu symptoms, all this comes under immune system. So if your immunity is well intact, all these things will not come. Symptoms might be sneezing, there will be cough, there will be constant coryza, that is the discharge of nose will be too much. That it can be watery, it can be acrid. Acrid is something that is thick. If that happens, of course you have to identify. Another important thing which is commonly seen in children is adenitis and nasal polyps. Now what is adenoids? So basically you must have heard your doctor telling you there are big giant adenoids or nasal polyps in your child's nose which have to be operated or which needs treatment or whatever. Okay, don't worry, they do not need to be operated, okay, to a certain limit of course. But what are these adenoids or what are these nasal polyps? First let me tell you, these are two total different things. Do not confuse them to be one. One is adenoid and one is nasal polyp. Adenoid is our normal nose tissue which is situated quite back from our nose. It is situated on a distance where when your nose is not able to take care of a infection, this adenoids tissue will take care of that particular antigen or the infection, whatever it is, virus or bacteria. It will swell itself to make the infection go away from your body through sneezing and coughing. That is the main function of adenoids. But when this adenoid tissue is so much swelled up that the patient is not able to breathe normally, that time you need treatment. How? I'll show you. This is normal adenoid and there is a infected adenoid, if you can see. So here, this is the normal adenoid over here, right? And this is the infected adenoid. Right? So when this adenoids get infected, they will cause problem. Otherwise, it's fine. Unless and until your child is telling you any symptoms, maybe the children will keep their mouth open during breathing, especially at nights. There will be difficulty in breathing. There will be difficulty in talking. There will be difficulty in swallowing. All these things come under this. If any of the symptoms prevail in your children, yes, you have something to worry about. Otherwise, that's fine. But exact opposite to this is nasal polyp. What is nasal polyp? As I told you about adenoids, nasal polyp is not at all healthy tissue. It is an outgrowth, you can say, from the nose tissue itself. It will hang itself like this from the nasal cavity, right? So if this is your nose like this, the nasal polyp will start growing from here and it will enter the nose cavity like this, right? So this happens when there is too much of infection and too much of your nasal immunity is compromised. If that happens, nasal polyps do occur and they look something like this. So this is your nose, you can see. These are the nasal polyps and they are very well visible through our normal vision. When you just put a torch in the patient's nose just to visualize, you'll be able to see it quite easily. Of course, for layman, it is difficult to differentiate whether it is a nasal polyp or an adenoid. Yes, experts can do that. Okay, so please see the symptoms and then you should check whether they really need treatment. Homeopathy, how it helps us. First, as I told you, for what homeopathy is famous, that it boosts the immune system. It gives your immune system the intactness and it will provide good amount of vitality for each and every immune barriers. Of course, with that there will be relief of symptoms. The symptoms will be totally gone. And if you give children homeopathy before 12 years of age, if your child is going through all these respiratory problems like sinusitis, allergic rhinitis, if he or she goes out, there will be immediate sneezing and coughing and whatever. If that is happening, please give your children homeopathy, because it is the best immune boost up mechanism or immune boost up system or science of medicine, and that really helps. Next, in the next growing years, if because there will be too much of exposure, that the children can be totally immune for the rest of their life. So that is the most wonderful advantage of homeopathy, especially in children. That was the today's topic. So I think that's it for today, and please take care, stay home, stay quarantined, take care of yourself. Even if you're experiencing any kind of symptoms, do immediately visit your doctor and see to it that you're not having any viral or bacterial infections. So please feel free to contact at all in any times, and take care. Thank you.